Καλησπέρα λοιπόν σε όλους. Για όσους δεν με ξέρετε, είμαι ο Γιάννης Πένας, είμαι ο ιδιοκτήτης της εταιρείας HNFC Academy. Η εταιρεία μας τα τελευταία χρόνια είναι ο αποκλειστικός αντιπρόσωπος της Αθλητιατρικής Ακαδημίας της Αμερικής και πολλών αμερικάνικων οργανισμών όπως είναι η FMS, όπως είναι η Exos, όπως είναι η εταιρεία του Michael Boyle και σήμερα έχουμε την χαρά και την τιμή να έχουμε μαζί μας τον Kevin Carr, ο οποίος θα μας παρουσιάσει ένα πολύ ενδιαφέρον σεμινάριο το οποίο έχει να κάνει με το Functional Training Anatomy. Το webinar αυτό γίνεται καθώς ετοιμάζουμε να γίνει για πρώτη φορά στην Ελλάδα το πρώτο σεμινάριο Functional Strength and Conditioning Certification, το οποίο είναι το σεμινάριο του Michael Boyle και νομίζω ότι όσοι ασχολούνται με το κομμάτι της δύναμης και της φυσικής κατάστασης γνωρίζουν το πόσο βαρύ είναι αυτό το όνομα στον χώρο. Τα σεμινάρια αυτά είναι σεμινάρια τα οποία ήταν να γίνουν πριν τον κορονοϊό στην Ελλάδα ζωντανά. Δυστυχώς το 2020 που θα τα οργανώναμε κλείσαμε λόγω κορονοϊού. Τώρα λοιπόν 2 χρόνια μετά θα πραγματοποιηθεί το πρώτο σεμινάριο μέσω live streaming. Άρα λοιπόν θα είναι ένα σεμινάριο το οποίο θα είναι μία μέρα με τον Kevin Carr, ο οποίος θα μας παρουσιάσει και θα κάνει την πιστοποίηση συγκεκριμένη το Level 1 τον Ιούλιο. Και από εκεί και πέρα ευελπιστούμε από τη νέα σεζόν, από το Σεπτέμβριο-Οκτώβριο, να μπορέσουμε να κάνουμε και το Level 2 και γιατί όχι, σιγά σιγά αν τα πράγματα δεν ξανακλείσουν, να μπορέσουμε να πραγματοποιήσουμε τα σεμινάρια και από κοντά. Τα σεμινάρια αυτά γενικά είναι advanced και είναι σεμινάρια λοιπόν τα οποία αφορούν, όπως είπαμε, τη δύναμη και τη φυσική κατάσταση. Σήμερα θα παρουσιάσουμε ένα πολύ ωραίο webinar, το οποίο θα έχει διάρκεια περίπου 1 ώρα και 1 τέταρτο. Οπότε θα κάνω πάσα αμέσως στον Kevin Carr και από εκεί και πέρα στο τέλος θα υπάρχει και 1 τέταρτο το οποίο θα μπορέσετε, άμα θέλετε, να κάνετε κάποιες ερωτήσεις είτε ζωντανά είτε στο chat. Αν κατά τη διάρκεια που θα ακούτε το σεμινάριο έχετε ερωτήσεις, μπορείτε να τις γράφετε έτσι ώστε στο τέλος να μπορέσουμε γρήγορα να τις φιλτράρουμε και να τις περάσουμε στον Kevin. Kevin, thank you very much for being here with us. I know that we are trying to do this for the last good 2 years now, but COVID messed everything up. But we are still here. We are still want to learn from you. I just inform our students how big is Michael Boyle's name on the sector and domain of strength and conditioning. We are very eager to see what this certification and the whole philosophy of Michael Boyle is all about. And we are very happy to have you here with us today to share with us this great webinar and start our relationship in order to educate more strength and conditioning coaches down the road. So thank you again, and please, you can start with your lecture.
Yeah, my pleasure. Thank you for having me. And yeah, I'll get right underway. Quick question. Are you planning to translate as I go? So do you want me to stop or do you want me to just... Okay, perfect.
Do your thing.
Perfect, okay. All right. So, here. Very good. And so, this presentation, Functional Training Anatomy, an anatomical guide to training, is essentially going to be an overview of how we look at building training programs for both our athlete clients, our professional athletes, our college athletes, our high school athletes, as well as our general population, everyday personal training clients. I think that, you know, when we look at training overall, the majority of how we look at programming is the same, no matter who it is that comes through the door. And the reason I say that is because ultimately they're all working with the same anatomy. They are all built with the body the same way, albeit we might be training at different intensities for different sports, but the overall way that we look at training is going to be very similar. And so we want to start with a basis and understanding of the anatomy that they're working with so it can better help us with our exercise selection, our programming, and our coaching. And so, quick little thing about me. If you don't know, I'm a strength conditioning coach and personal trainer at Mike Boyle Strength Conditioning in Boston, Massachusetts. I've been here for about 15 years as a coach. I'm also a massage therapist and rehab coordinator. I have a business called Movement is Medicine, and I work as an educator through Certified Functional Strength Coach. And many of the concepts that I'm going to talk about in the next hour or so are out of my book that I released over last year called Functional Training Anatomy, which kind of gives you an illustrated explanation of the exercise selection and coaching that we use in CFSC and we use at Mike Boyle Strength Conditioning. And so, kind of taking it back to the very beginning, my first job in fitness was at a Gold's Gym in the town I grew up in, not far from where Mike Boyle's Strength Conditioning is now. I was about 18 years old. And like any other 18-year-old guy, like I really didn't know much about strength and conditioning at all. I really just worked there so I could have a free gym membership. I could work out for free. My workouts really consisted of whatever was in muscle and fitness at the time. So, whatever the bodybuilding workout of the day was, whether it was, Jay Cutler's chest workout or, Ronnie Coleman leg workout, like that's what I was doing for a workout routine, just kind of whatever was in the book. And so for me, I didn't even know what functional training was until one day there was a independent trainer that worked there. His name was Clark Evans, and I looked over and he's doing hang cleans and he's doing split squats and he's doing chin-ups and he's doing single leg squats, all these things that I had never done before. And I asked him, I said, where did you learn all this? And he told me he had done a mentorship with Mike Boyle, who at the time was a strength conditioning coach for BU men's hockey and for the Boston Bruins. And he said, I did a mentorship with him over a course of a week. And he's like, you should really look into it. And so, from there, I applied for an internship at MBSC. I was about 18 years old, and lo and behold, I got it. And when I first came into here as a facility, it was like nothing I'd ever seen before. You had, regular everyday people in their 50s and 60s who were running, who were jumping, who were doing hang cleans, and they were training like athletes. And then you also, of course, had college and professional athletes doing the same thing. And they weren't stuck to a machine. They were lifting free weights, they were running, they were sprinting. And it was like nothing I'd seen before, and it was amazing. And so it opened up my understanding of training completely. I had never seen anything like that before. And so in this presentation, I hope that maybe I can give some of the same understandings or enlightening moments that I've had in my experience working here to the people who are, here listening today. And I imagine if you're here today, you probably already have a pretty good understanding of what you're doing, or you probably wouldn't be pursuing continuing education on a Saturday morning. But I hope that there's probably a few things you can take with that'll help you. So when it comes to functional training, I think we first need to understand what is functional training in the first place. It's kind of one of those buzzwords that I think get an emotional reaction out of people when they hear the word functional training. I think some people might think about this woman on the far right side of the screen who's standing and balancing on the ball, where others might hear functional training and think, functional training is powerlifting, right? Everyone has to get up and down out of a chair, get up and off the toilet, so everyone should back squat. Whereas probably many of us might think about functional training and they see this gentleman here in the middle doing something like a rear foot elevated split squat. So I think before we can kind of talk about practical application, we want to be able to clearly define, what does functional training actually mean? Does it mean that someone's just standing on a Bosu ball and they're wrapped up in a bunch of bands and doing some crazy stuff? Or is there probably a better definition that we can come up with? And to me, if I was going to define functional training, I would say, if we're going to put it into one word, I would say that it's purposeful training. It means that we're being thoughtful in our exercise selection, in our exercise application. And I think that gives us a really broad definition in how we can define what functional training actually means. Because I don't think it's going to be represented by a specific exercise or a specific philosophy as much as it's represented by making exercise selections that are specific to the clientele who's standing there in front of us. And that gives us a lot more options to work. And so if we're going to provide a longer, more nuanced definition, I would say that functional training means we are purposefully selecting exercises to improve a specific outcome, and we're basing those selections on the structure and function of the human body. That's it. And so if we are going to go with that definition, it doesn't mean that we have to select specific exercises, or it doesn't mean that we have to train with a certain tool or train with a certain rep scheme or periodization. It means that we're selecting our exercises based on anatomy and based on the intended goals of the clientele that we're working with. And when we think of it that way, it gives us much more room. It doesn't pigeonhole us into one single way of training. So going back to some of the things I referenced previously. Now, like I said, many people might look at this and say, oh yeah, that's like functional training. And that's why they write off functional training and say it's a waste of time, or it's silly, or it's not applicable. But maybe this would be applicable if this lady's intended goal was to do something like this, like performing in a circus, right? Now, by and large, many of the clients that you're going to work with probably don't have those goals in mind when it comes to training. So I would say for the majority of you, that might not be standing on a BOSU ball or stability ball might not be a great choice. However, if their goal is to be a circus performer, maybe that is what you want to do. Likewise, more traditional approaches to training, like back squatting, fairly popular, right? I think we're really influenced by strength sports in this field, things like powerlifting and Olympic lifting. However, the majority of our clientele probably does not need to develop max effort bilateral strength for their everyday activities or sporting activities. Doesn't mean it's not a valuable tool. However, as far as carryover to everyday life, there's probably less here, unless, of course, you plan to compete in powerlifting or bodybuilding or Olympic lifting. Just another tool. But what I would guess is that the majority of your clientele looks something like this. Either a beginner learning fundamentals, like on the far left, with the bar across his shoulders, a competitive athlete. This is a college baseball player in the middle doing split squats, or on the far right, probably the majority of people that you work with are just everyday individuals who want to feel better, they want to look better, they just want to get through their everyday life without pain and feel like that they're still fit, and maybe they want to lose a few pounds. You know, people in their 40s, their 50s, their 60s, what have you. And so when you look at that, I think we're going to try to define functional training today around these types of populations. People with a relatively low training age, people who are participating in competitive athletics, or just people who want to look and feel a little bit better. And I think that's going to encompass probably 90% of trainers out there, their majority of their population that they're working with. It's a great quote from sports scientist named Jorge Carr, and he says, your sport's not different, you just think it is. And when you work with a lot of individuals, or you work with a lot of athletes specifically, they typically think they need sports-specific training, or they need training that's very specific to them. But the irony of that is that we're all coming into exercise with the same basic structure. And although we might have different sports, we might have different individual goals, many of the same general training approaches based around our anatomy and how our body works are going to have pretty good high levels of carryover to their everyday activities. And so if we think again about our clients, that those three average clients that we see on a daily basis, general population adult clients, low training age clientele, or team sport athletes. Like this individual here is a professional hockey player that we work with. And although they all have specific outcomes and goals that they want to get better at, all their training is going to be fairly general, and it's all going to look fairly similar in our application and our program. I think 80-20 rule, the Pareto principle, right? 80%, 80% of the things we do are going to be fairly similar, and about 20% of them might have individuality in that case, because we're all working with the same body to get towards fairly similar outcomes, albeit maybe at different volumes and intensities depending on skill level, experience, and their end goals. But the overall outline of a program is going to look fairly similar, right? And so if you look at this image here, if you look at the big red side of the screen, I mean, if you think about the things that our clients want or that we know that they need, generally they want to feel better. They want to improve their overall movement quality. They don't want to feel stiff. They want to be able to, get their arms over their head. They don't want to feel stiff when they get out of the car, whatever it might be. Our athletes want to be more powerful. Generally, most people want or need to be stronger, whether they know it or not. Our athletes want to be faster. Both our Gen Pop and our athletic populations need to improve their cardiovascular fitness, whether that be for health or for performance. And just especially for our Gen Pop, they generally have body composition goals like losing weight or dropping some body fat. Whereas on the right side in the white, that's that 20% or even less, right? You're going to have, the exceptions to the rule typically are things like anatomical abnormalities, having to program differently for those, extreme mobility considerations, skill-specific training, or max effort bilateral strength are probably in the minority of things that we need to train for. It's not to say that we don't ever have to think about those things. However, we do probably need to think about the things on the left in the red far more often than the things on the right. And so a general functional training program should generally look like this. No matter who the people are that we're working with, our structure is going to look pretty much the same. The ratios of time that we spend or the amount of intensity applied within those blocks might vary. However, everybody we work with is going to follow the same general structure as they come in to work with us, right? So they're going to come in and do some sort of mobility and preparation. It's not going to be a major part of the program, maybe 5 to 10 minutes. They're going to go through some sort of active warm-up and movement skills with our athletes. Maybe we spend a little bit more time here developing things like sprint skills or change direction drills. They're going to go through some general power and speed work, things like jumping, hopping, bounding, and throwing. Their strength portion is going to be kind of the main chunk of the program where they're going to be pushing, pulling, hip dominant, knee dominant, and core exercise spread out over, 2, 3, 4, 5 days, depending on how many days a week they might come in to train. And then there'll be some sort of generalized aerobic or anaerobic conditioning work at the end to develop their cardiovascular system. And so again, none of those things are really going to change. And I always say training is a recipe, not a menu. You don't get to pick what you want. Everybody is going to get something from the recipe, just in different sizes and different ways, right? When you make anything, when you follow any recipe, you might slightly change the proportions of the things that you put into it, but you don't typically ever omit anything out of a recipe, right? And so we don't let people just say they want to do mobility or just do conditioning or just do strength training. We're typically going to apply all of those because that's going to develop an athlete or a client who's more well-rounded and is going to be generally more resilient to the varied stressors that they're going to face on a daily basis. If someone is strong but lacks mobility, they're probably at risk for muscle strain or joint damage due to lack of joint variability of movement. An athlete who's extremely mobile but is strong would get overpowered or lack the ability to produce the amount of force necessary. And for a Gen Pop client, they won't age as well because we know they get weaker as they get older. An athlete who lacks aerobic condition won't be able to maintain their power output over the course of a session. And a general population client who lacks aerobic conditioning is at risk for things like cardiovascular disease. So we don't want to think we want to only pursue one singular quality. We want to try to develop them all concurrently as we really do in our programming. And so if that kind of provides us an overview of what we determine and define functional training as, now we can move on to defining what functional anatomy actually means. What is the difference between that and our traditional anatomy understanding? And then how does that actually matter when it comes to practical exercise selection and coaching? So when we think about gross anatomy, what you probably all learned if you went to college for exercise science or something along those lines, you probably took a gross anatomy course at some point, right? And read a lot of books that looked like this, where the guy is in the supine position and you're learning just basically what the names of each muscles are, what positions they're in, their origins and their insertions, their pronation, their innervation, their articulation, their position, their size, all those basic fundamentals, just so you understand your way around the human body. And that's very structural based. And it's really valuable because if you don't know that, you don't really have a starting point to go off from, correct? However, they can be a hard jump sometimes to go straight from that to understand how muscles actually work in space and help us move. Unfortunately, we don't exercise lying flat on a table. We're going to be vertical. We're going to be in different positions, and those things are going to affect how our body moves and what muscles do what. And so to understand functional anatomy, you have to understand the interplay between the actual muscle joint actions, the planes of motion that the body is working in, and the positions that our body are in that are going to affect how our body and those muscles actually function. Right? And so understanding actions, what muscles are concentrically, eccentrically, and isometrically working, which ones are agonists or antagonists, are really important because when we're thinking about having carryover of our exercises from the weight room to whatever their everyday activities or sports are, we need to understand what exercise selection is going to provide us an optimal outcome. Also, understanding which exercises can provide us benefits in different planes, right? Traditional strength training approaches are going to be more sagittal plane focused, which is a great thing for a beginner. However, as we progress and look for more specificity of our programming and more carryover to our end goals, we want to start to look for exercises that are going to be more specific to multi-planar approach. And then lastly, how do positions in link tension relationships affect how muscles actually work? Because our muscles are really just slaves to the positions that we put them in. If we put them in better positions to contract, we're going to get better outcomes. If we put them in poorer positions to contract, we're going to have poorer outcomes, right? And so these things are important. So in this single leg squat, understanding, what the quadricep is doing, what the hamstring is doing, how the adductor and glute medius are working in the frontal plane, even though there might not be prime movers, and how your glute might be assisting the quad for you to complete that movement. And we're going to get a little bit deeper into single leg training later from a practical standpoint and discuss this. But all of these things are fairly important in understanding our exercise selection quality, right? Again, understanding what does concentric, eccentric, and isometric mean. And now all of you probably, this might be review, but understanding that and understanding what actually happens during our end goal activities is going to help us better choose our exercise selection ahead of time, right? We want to make sure we're selecting exercises that execute the same actions as our end goal activities that we're training for. Again, understanding our planes of motion, right? What our sagittal plane, our frontal plane, and our transverse plane, and then understanding our exercises that are going to stimulate the muscles to work in those planes. Again, like I said, the majority of our exercise selection in the weight room is going to be very sagittal plane focused. So how can we expand beyond that and begin training in the frontal and transverse plane, where we're going to have the majority of our motion taking place in our sporting activities? And then understanding that joint positions dictate muscle function. Overly lengthened or overly shortened positions aren't going to be ideal positions of leverage for muscles to contract. And so this is going to affect how we coach certain exercises so we can get the outcomes that we really want, right? So in this example, if someone is extended, right, the rib cage is relatively elevated, their pelvis is relatively tilted forward, that means our abs are going to be more eccentrically loaded, our hip flexors are going to be more concentrically loaded, our lumbar paraspinals are going to be concentrically loaded, and our hamstrings are going to be eccentrically loaded. None of those things are really good or bad in and of themselves, right? They're just positions, but they are going to affect how muscles contract. Right. And then finally, understanding what happens locally and globally during a movement. And this is really going to help guide our exercise selection, especially in our single leg lower body training. Although if you were to watch this individual here do this rear foot elevated split squat, you would see him move and you would say, oh, he's moving primarily in the sagittal plane, right? He's moving up and down, forwards and backwards. Not a lot of motion side to side in the frontal plane, not a lot of motion rotationally in the transverse plane. However, whenever you do anything on one leg, you're going to introduce local stability challenges, local planar forces that need to be stabilized for you to be able to do the exercise correctly. If you train anybody and you've ever tried to teach a split squat to a beginner on the first day, what do they look like? They tend to wobble, they tend to go side to side, they tend to rotate, mainly because they haven't developed frontal and transverse plane stability in things like their obliques, their adductors, their glute med, even their lower leg and lower foot, to be able to offset those local planar forces that come from being in a unilateral position. Right? That's why it's much easier to teach sagittal and bilateral based exercises to beginners, because they have a bigger, better foundation, and then we can move towards things that are going to challenge them more in those other planes of motion. So even though this individual in the split squat here is only moving up and down and moving in the sagittal plane, they're constantly working in the transverse and frontal plane to be able to maintain the position that they're in. And they're doing that through things like our anterior and posterior oblique systems. Our body was evolved to function unilaterally over time, right? We don't move two legs at a time and two arms at a time. We move one arm and one leg at a time. And we run, jump, and throw in these contralateral patterns that demand us to connect our right side of our body and our left side of the body through our fascia, through our cross oblique systems, to be able to move in that pattern. And by doing things that are primarily done unilaterally, it's going to reflect the evolutionary structure of our body more efficiently, right? When we're doing things on two legs or with two arms at a time, we're not necessarily recruiting those systems as efficiently as possible. Again, not good or bad, probably great for beginners. But as we progress on, we want to think about trying to develop and select training interventions that reflect the structure and the way that we move on an everyday basis. And so as we start to move towards more a practical application section of the presentation, I want to go through kind of 4 programming questions that I tend to use when thinking about exercise selection. And so I always kind of go through and audit myself and ask these 4 things, as they're going to kind of help you better select exercises to have greater levels of carryover. Number 1, am I loading the appropriate tissues? Is the exercise that I'm choosing providing load or stimulus to the tissues or muscles or ligaments or fascia that I'm trying to load? And with that, am I loading the appropriate joint positions, right? Because you could load a muscle but not be in the position that you want to have carryover to their sport or their activity. So we want to make sure we can check both of those boxes. Am I addressing the specific planes and actions that I need to? Again, you could be training someone's legs on 2 legs, but not developing them in the frontal and transverse plane, whereas you could be training them on 1 leg and check all those boxes and answer all those questions more adequately. And then probably most importantly, in doing so, can I load at the volume and intensity and speed that I want? Being able to load the tissues and joint positions and planes that you want is all great, but if you can't do it at the load or speed or volume that's going to prepare them for either their sport or everyday life, then it's probably not a great exercise selection, because we need to have enough stimulus to match the stressors that they're going to have to prepare for in whatever activity they're training for. So kind of with that understanding and background, now we can go into some specific practical application examples to help us kind of better understand what I'm talking about. And what I did here is I took kind of 3 or 4 examples from the book that I tend to end up talking about a lot with people, that kind of draw examples of how we can use functional anatomy to better build programs that are going to have greater levels of carryover. So let's start with the lower body specifically and talk about hamstring strains. So hamstring strains are the most common soft tissue injury in all of sports. Across all sports, we see them at a greater occurrence level than just about anything else, non-contact specifically. And to better understand how to reduce them, we want to understand the anatomy and function first, and then we can think about our exercise selection. So why don't we talk briefly about what hamstrings actually do as it pertains to gait specifically in walking and running. When we're going through the gait cycle, the hamstring has three really big jobs that it's responsible for. So concentrically assisting hip extension along with the glutes, eccentrically decelerating knee extension right just prior to foot strike, and isometrically controlling the positions of the pelvis throughout the gait cycle in the sagittal plane, right? When you look at EMG studies and you look at all the research around running, these are the three major activities that a hamstring has to complete throughout the phase of the gait cycle. Now, notice I omitted the big one that everyone usually says. The first thing we probably learned in when we learned anatomy was the hamstring is a concentric knee flexor, and that it is. It will absolutely concentrically flex the knee. However, when you look at its activity during the gait cycle, that's actually its least demanding task. Much of the knee flexion happens actually from the gastroc actively contracting after foot strike. There is some hamstring activity, but it's much less actually than its function in these three other activities. Not to say it's not important, but we need to prioritize these three activities, I think, higher in our training process before we actually think about active knee flexion. So what do we know about hamstring strains? Specifically, the biceps femoris long head is the most commonly injured of all the hamstring muscles: semimembranous, semitendinous, biceps femoris long head, and short head. The overwhelming majority of strains happen in the biceps femoris. That doesn't mean they don't happen in the other ones, but just something to think about. Most commonly, it's injured during the terminal swing phase of gait, the very end of swing phase into heel contact. So if you're looking at that little guy running across the screen there, it would be number 1 and number 7. That's where most of those hamstring strains happen, right as you're about to hit the ground. And if you think about what's actually happening during that specific phase, there's very high eccentric load in the hamstring because we're decelerating the lower leg, the shank, the tibia from swinging forward. We're still stabilizing the pelvis in that isometrically in that sagittal plane. And just after that, we're going to go into a high velocity hip extension going backwards. So essentially your hamstring is doing multiple jobs and multitasking in conjunction with the obliques, with the glutes, and the gastroc actually as well, decelerating the extension. And so there's a high stress, especially eccentrically on the hamstring, hence why that is where we see the majority of strains. And so when we comes to our exercise selection with these things in mind, we want to select exercises that provide high eccentric load, demand stabilization of the pelvis, and demand hip extension in conjunction with the glutes. Those are the boxes that we want to be able to check when it comes to our exercise selection, so we can prepare people for the stressors that are going to come from them sprinting. Typically, most hamstring strains come early in preseason. If you look at soccer and football, there's usually a big peak in hamstring strains early in the season before these athletes are conditioned to the demands of sprinting. Additionally, when you look at the research around hamstring strains and they track athletes over the course of a season, what they find is that athletes who suffer from hamstring strains typically present with increased hip flexion angles or increased anterior tilt presentation. Now, again, not necessarily good or bad, but it is a data point you want to think about. Increased medial knee rotation and reduced biceps femoris activity when compared to the glute on the same side. And so, again, we want to think about battling these tendencies in our coaching and our application of these exercises, right? And so let's talk a little bit how position dictates function and how pelvic positioning specifically can affect how our hamstrings and glutes and abdominals all work together. So eccentrically loaded hamstrings, glutes, and abdominals are in poor positions to contract and produce force, right? When muscles are lengthened, right, it's very hard for them to contract, right? If you think about if my arm was completely straight and I put a big dumbbell in it, it's harder to curl from the bottom than if I started at mid-range, right? Because of the length tension relationships. Concentrically loaded muscles also will present with increased tone, right? So in this picture, in this example specifically, while someone's in a more anterior biased position of their pelvis and rib cage, you're going to see their rib cage, their abs are going to be eccentrically loaded, poor position to contract. Their hamstrings are going to be eccentrically loaded, poor position to contract, lots of eccentric tone. Whereas their lumbar muscles are going to be shortened and their hip flexors are going to be shortened, and they're going to have resting increased tone in those muscles. And so to better coach and better optimize our positioning, we want to try to take people a little bit the other direction. And so here's a good example. Say not all leg curls are created equal. Typically people are doing things like this where you're laying on a machine on your stomach and doing leg curls. But typically what we're going to do is what we call something like a slide board leg curl or a Val slide leg curl. And like I was saying, we want to think about the functions of the hamstrings, the glutes, and the abdominals during the gait cycle. So specifically, as you see Brendan, he's getting hip extension with his glutes and his hamstrings. He's getting eccentric load through his hamstrings as he slides out. And he's also maintaining the pelvic position using his abdominals and his hamstrings, right? He's not sticking his belly up to the ceiling. He's creating those same demands that happen during the gait cycle. Whereas this young lady on the left doing the leg curl on her stomach, there's really no demand for hip extension. She's actually in hip flexion. There's zero demand for her to use her abdominals to maintain the position of her pelvis. And she's just getting concentric and eccentric loading of the hamstring. So it's a much more isolated approach to training, whereas with something where you actually have to stabilize your hips, extend your hips, and maintain your pelvic positioning is going to create a greater global demand that's going to carry over greater to something like running. Similarly, something like a single leg deadlift, we want to try to think about training in the positions that we're going to see in sport. If you looked at that heel strike position here, if I go back, where the foot is hitting the ground in number one with slight knee bend, and he's going to begin to hinge, we're looking to recreate that with heavy single leg loading and high eccentric loading with something like a single leg deadlift, where you can provide high amounts of eccentric load and rapid hip extension with the glutes and the hamstrings. Again, trying to recreate the stressors that we're going to see in sport. Again, like I said, slide board leg curl, high eccentric knee extension, high demand, concentric hip extension, and isometric control of the pelvis. And then finally, one last thing when it comes to thinking about reducing hamstring strains is you have to consistently expose the athletes to high speed sprinting. All of the things we do in the weight room are great from a structural standpoint, developing strong hamstrings that can withstand a lot of force and produce a lot of force. But probably one of the things that most people don't do enough of when it comes to hamstring injury reduction is actually sprinting. Because if we go back to those questions that I asked before, what was the fourth one? Can I load at the volume, intensity, and speed of contraction that we need to replicate the demands in sport? And no matter how much you do in the weight room, you're not going to be moving as fast as you do on the field of play. And I think that's where a lot of athletes run into trouble in their training. They train very hard in the weight room, but they don't do a lot of sprinting until they actually play their sport, right? They may be working about 80% or so in practice. And when they actually get on the field of play and run at 100%, that's when they run into problems. And so to run fast, you have to run fast. And to reduce the likelihood of hamstring strains, you also have to run fast. So every single day with our athletes, we're running time sprints like you see here through a timer to promote effort. Number one, if we give them external feedback in their time, we're going to get harder efforts in running from them in the first place. And it's also going to condition their hamstrings, their calves, their feet, their glutes to the high speed demands of sprinting that they're going to have to participate on in the future. And so I think you have to check all these boxes and to answer all these questions. You have to be doing things like slide board leg curls. You have to be doing things like heavy single leg bridging, as well as loaded single leg deadlifts, and then also sprinting. I think if you check those boxes, I'll tell you specifically with our athletes, we see very few non-contact hamstring strains with our athletes here, like sprinting related, very, very rarely. We do get them referred in and rehab them, but because I think we take this approach where we're not overly focused on machine-based approaches to hamstring development and we're having them sprint consistently, we see a great reduction in the amount of hamstring strains overall. Staying on the lower body, we're going to move and talk to training on one leg and why we tend to prefer unilateral approaches specifically for our athletes and our everyday population. Again, like I mentioned briefly earlier, if you look at how we're built anatomically through pronation and through joint positioning and how the muscles are developed, we're really meant to function unilaterally. We have these subsystems that allow us to rotate and swing our arms in an opposite arm, opposite leg motion, because we really move through everyday life one arm and one leg at a time. And in sports, we're constantly going to be stressed in these unilateral positions. And so we want to be able to train in a way that prepares us to be powerful and be strong and be stable and be fast in these positions specifically. So when we think about traditional approaches to training, powerlifting, Olympic lifting, strongman, bodybuilding, they're going to be very sagittal and bilateral in nature. And strength and conditioning and fitness as a whole is very influenced by these approaches to training because this is really what came first. And that's good. I mean, these are very valuable in teaching fundamentals and developing basic strength. We goblet squat everybody. We trap our deadlift and kettlebell deadlift everybody. We do many things on two legs or with two arms. However, they're not going to have great levels of carryover as we move towards specificity of sport and even specificity of everyday life. And it's important to realize that the reason that these approaches are favorable in things like powerlifting and bodybuilding is because they have the least amount of variability in them naturally. When you're on two legs, there's going to be much less variability in how, or variation, I should say, in how you move from rep to rep, because you're in a more bilateral and balanced stance. And these are really optimal ways to train to produce the maximum amount of force or move the most amount of load or drive the most amount of hypertrophy into the system. That's why bodybuilders prefer machines and bilateral approaches, because they can train more volume with less variability, right? And that's why powerlifters prefer these. Outside of the fact that these are the actual movements they test in, you can move the most load. Very valuable for those activities. However, those are not the intended goals of training for just general health or training for athletics. And so these are just going to have less carryover as we move down the spectrum of specificity for our clients. However, our unilateral approaches are going to be more valuable in developing frontal and transverse plane stability and strength and power, unilateral in nature, and they're just going to have higher levels of carryover to the dynamic sporting environment in everyday life. And they're going to rely less external load and less overall axial load on the body, which is going to allow generally for more repeatability and less overall stress to the athlete, someone who has to compete on an everyday basis. And so just some examples of single leg training. Like I said, again, less spinal loading. So maybe for this woman who's 60 years old, I can get a large training stimulus for her legs without having to stress her spine. Again, working on training on one leg, like this individual, you see his head over his hip, over his knee, over his foot. It's going to allow him to develop multiplanar stability in his hips and adductors. These individuals here doing split squats. It's going to allow us to put more stress into the legs. It's important to realize when you see someone fail in something like a back squat, the point of failure is almost never the legs. It's almost always the spine, right? Our spine acts as a force transducer from the ground to the bar. And so when we take that out of the equation and have them do things unilateral in nature, we can actually put more training stress into the quads and hamstrings and glutes than we probably can using something like a back squat. And so hence why we would probably choose to do most things on one leg. Also, like I said, lower overall system load. When you have someone like this competitive athlete who has to play multiple games every week, if I'm able to get the same training result with half the actual external load, their nervous system is going to be less fatigued. So I can typically train more frequently with less detriment to whatever their everyday activities are. And we have the idea of the bilateral deficit. I think that video of me doing this is about 275 pounds on one leg. I can tell you certainly that I'm not a 500-pound deadlifter on two legs. So, we know that we can get greater than 50% of load out of two legs than we can on one leg. So something to think about. And so Alex Natera has done some great research on this. He's a rugby researcher and strength conditioning coach based out of Australia. He's a very brilliant guy. And what they did is they tested on force plates, force production in single leg squatting and bilateral squatting. And what they found is something like a skater squat or a single leg squat, right? Done with 50% of your body weight. So if I'm a 200-pound male and I have 100 pounds worth of vests and chains or dumbbells and I'm doing a single leg squat, that produced the same peak force as doing a double body weight bilateral back squat. And so when you take that into account, again, I'm able to get the same force production with less external load on the body. So it's a more efficient approach to take to training. So if I take a quote out of the study, it says unilateral squats with same external load per leg produce greater peak vertical ground reaction forces than bilateral squats, as well as higher barbell velocity, which is associated with strength development, rate of force development, respectively. And so again, you're able to get more with less. And in training, with time and effort being our number one variables, things that we're trying to get more of, looking for more efficient approaches to training, I think, is always going to be valuable. Additionally, I think you also have to think about single leg plyometrics. Like I said, speed of contraction is also very important. I don't think there's a much more valuable tool than single leg plyometrics in terms of improving eccentric deceleratory control, our ability to land and contract and absorb force, our ability to contract quickly and produce power and elasticity. Again, if we're looking for carryover for sports, we have to look beyond just the weight room and think about also doing things where we move fast and are athletic. And so I think single leg strength training and single leg plyometrics really go hand in hand, because strength training is going to build a strength foundation for us to be able to land efficiently and produce force. But ultimately, we also need to be able to produce power and do it quickly. And in a similar study, similar to the Alex Natera study, what they did is they compared unilateral plyometric training and bilateral plyometric training as far as force production goes. And what they found is unilateral plyometric training was more effective in increasing both single leg and double leg jumping performance, as well as isometric leg press, maximal force, and rate of force development when compared to bilateral jumping. And so single leg training, unilateral training will have greater carryover to bilateral activities, where bilateral activities will not really have carryover to unilateral activities. And again, if we're thinking about efficiency, then I would probably hedge towards unilateral approaches most of the time. Again, asking the questions: am I loading the appropriate tissues? Am I loading the appropriate joint positions? Am I addressing the specific planes and actions? And can I load the volume, speed, and intensity that I would like to? And the answer is yes in this case. Now we're going to move on to the trunk and the torso specifically. And how should we look at training the trunk? I like to refer to it as trunk training as opposed to core training. I just think it's more inclusive overall. When you hear core, most people just think about the muscles in the front. However, it's more than what you can see in the abdominals. It's the deep abdominal muscles like the transverse abdominis, the pelvic floor, the diaphragm, and the multifidus. And it's also the stuff on the backside like the erector spinae, the lats, the serratus posterior, and the obliques. All of these things make up what would be traditionally determined as core musculature or trunk musculature. And so let's talk about, similar to we did with the hamstring, what do core muscles actually do on a daily basis? Mainly, if you think about any activity that we go through, they really work to brace and buttress against outside forces to create stiffness around our core, around our organs, around our spine, to keep all of those things safe. That's the number one priority. But then they're also mainly isometric and eccentric controllers of trunk motion, more so than they are dynamic creators of trunk motion. It's not to say that they don't function concentrically, they do. However, most of the time we're producing force from our upper and lower body and using our trunk to transfer that force from one end to the other. And in doing so, they have to isometrically and eccentrically control the positions of our trunk so we can transfer that force most efficiently and not lose it inefficiently, right? Going back to this example before, so the trunk muscles specifically, again, position will dictate function. Again, if we're overly extended or overly flexed in one direction or side bent one direction or the other, our muscles aren't going to work as efficiently as possible. So being able to control these positions are going to allow us to be more efficient and be able to transfer more force. Right. And so in looking at these examples out of the book here, teaching our athletes to be able to control the position of their rib cage and their pelvis in space, or control the position of their rib cage and their pelvis in the frontal plane, is going to allow us, that woman hitting that tennis ball, to more efficiently put that force into the ball. If she opens up her rib cage and can't keep tension in the front, she won't hit the ball as powerful. If she side bends too much, she can't hit the ball as powerfully. Being able to be stronger and be able to create and control that force is what allows us to put force where we want it to be. And so much of our training approaches are going to be centered around what we call anti-core training, being able to control our positions in the presence of outside forces. Again, it's not to say that we don't move, we do, but it is to say that much of the goal is to teach our athletes how to maintain positions while we're stressing them with some sort of stimulus. And we're going to do so by first focusing on sagittal plane competency and stability first, and then moving towards things like transverse and frontal plane stability from there. I think if we establish a good relationship in the sagittal plane of the rib cage and the pelvis, like we did in the pictures, all the other stuff tends to work much better. So this is going to be a foundation for pretty much everything that we do, working on things like planks and ball rollouts first, so that they can strengthen those anterior core muscles and not fall into extension, and then move towards these frontal and transverse plane approaches here. Because if I'm doing something like an anti-rotation press shown in the picture and my rib cage is really elevated in the sagittal plane, it's not going to be an effective exercise anyways. So we want to teach them how to get those, the rib cage and the pelvis in a better position to control and contract and create stability. Like I said, that doesn't mean that the spine shouldn't move. It should. If you look at the image with the spinal range of motion at each level, you can see that certain positions of the certain segments of the spine are going to be more fit for different ranges of motion, right? High amounts of sagittal plane movement in the cervical spine, but very little amounts of sagittal plane motion in the thoracic spine, and then moderate amounts of sagittal plane motion in the lumbar spine. Then when you get down to transverse plane, there's very little motion, especially in the lumbar spine, very little side bending available because of how wide those facet joints are. And similarly with lumbar, there isn't much rotation there either. There's about 12 degrees total when you add up all of the rotation in the lumbar spine. So we have deliberate constraints built in. That doesn't mean we shouldn't move within those constraints. However, trying to force more range of motion into joint systems that don't actually have it is where we tend to run into problems. And so when people do high volumes of flexion and rotation-based trunk work, that tends to be why you see people end up with things like facet strains and whatnot that might cause irritation. I think our goal should be to move within the range of motions that we have, stay within the deliberate constraints, maintain capacity and normal range of motion. If you can't flex and move your spine, you should be able to do that. But we should be training all these motions in conjunction of motion with our hips. Because in sports, our spine is pretty much never moving alone in isolation. It's going to be moving along with our arms and our thoracic spine and our hip rotation and our lower leg rotation. And we want to think about integrating them together that way in sports. And so what actually happens during rotational sports at the trunk? Rotational strength and power is much less about producing spinal motion and much more about controlling it. There's usually very small amounts of disassociation between the trunk and hips during rotational activities. If you look at someone like Mike Tyson at the top there punching, you can see his shoulders and hips are moving together. He doesn't have a large amount of disassociation in between the two. Similar to this individual hitting the baseball at the bottom, you see his hips and shoulders rotating in one piece as opposed to being separated from one another. It's because those trunk muscles, their job is to transfer that force that both of those individuals are producing from their legs and transfer that force up to their hands, right? If you're going to punch really hard or you're going to swing a bat really hard, it starts by pushing into the ground and then us carrying that force that we produced into the ground up into our hands. And so the trunk has to be able to move with the pelvis, not antithetical to the pelvis. And that's what we want to see. And again, like what do you see in rotational sports? Look at someone like Tiger Woods. We have high amounts of thoracic rotation, right? You see his T-spine getting, in that first image, almost 90 degrees from the rest of his body. But then as he comes down through the ball, you're going to see his entire trunk squared up over the ball so he can produce force where he wants it to be. Similarly, when you look at golfers or rotational athletes who have high levels of lumbar pain, specifically people with disc injuries and facet strains, they tend to present with lower levels of hip mobility compared to those athletes who do not. Because if they do not have the hip rotation necessary for that rotational sport, they're going to tend to have higher levels of lumbar rotation and lumbar stress as a result of that. This is a really good example here when I play this video. Again, the rotation and rotational sports, most of the motion of the spine during rotational sports is actually going to occur at the thoracic spine as opposed to the lumbar spine. Much of the training approaches that you see traditionally revolve around lots of lumbar rotation. However, what we're going to see is that most of the motion actually happens in side bending and rotation of the thoracic spine specifically, right? His lumbar comes through with his hips, but you're going to get lots of side bending and flexion through the thoracic spine so he can produce force in the direction that he wants. Hence why it's important for us to maintain thoracic mobility, for us to be able to move efficiently and for us to be able to produce force where we want it to be. Hence why training approaches like this, where there's going to be a fixed pelvis and large amounts of rotation, don't necessarily have carryover to sports that we want. We need to be able to see the hips move in conjunction with the trunk. And in doing so, we're going to follow a formula like this. So when I have an athlete who's rotationally based, something like a baseball player, a boxer, or a golfer, we want to first focus on developing sagittal plane trunk strength first, then move towards transverse and frontal plane trunk strength, and then ultimately transverse and frontal plane power. So we want to start to move at higher contraction speeds as we go, right? So that might mean starting with something like a ball rollout, front plank, where we're creating anterior core strength and tension, right? We're trying to teach the athlete how to maintain optimal alignment between their rib cage and pelvis in spite of the higher levels of torque that they're seeing as they're going out. And then developing something like frontal plane stability. So whether that's something like a side plank or a suitcase carry where they have to maintain side bending positioning, create and develop strength and tension in their abdominals and their obliques. And then moving towards things that are transverse plane and rotational nature. So whether it's me actively pressing that stick in the wall and creating an isometric rotational force, or me doing an anti-rotation press out like this where I'm resisting rotation from side to side. Or me doing something like a push-pull exercise here where I'm creating rotation but not letting myself turn. And then starting to integrate it into more full body approaches. So whether it be something like a chop and lift, where she's going to be getting anti-rotation, anti-extension, we're having her couple thoracic and cervical rotation with a stable lumbar and pelvic position. And then again, like I said, examples of where we want to see the hips rotate along with the trunk. This is ultimately how we begin producing power. See, I'm pushing into the ground and then rotating my pelvis and lumbar to produce that force and push it into my hands. And ultimately in sport, that's how we're going to produce and transfer force. And then again, we have to connect that to higher speed contraction, things like throwing a medicine ball, right? So we're going to use lots of medicine ball exercises in our programming so that we can have, again, greater levels of carryover to sport. Now, a lot of times I give this presentation and people think that I'm like the fun police. That doesn't mean we can't do things like squats and curls and arm days and ab days. All that stuff is fine. It's not going to make you worse. It just might not necessarily have carryover to the things that you want, right? Again, that doesn't mean necessarily the isometric or isolated or bilateral exercises that are bad. I don't think they're necessarily bad, but I think for everybody that you're working with, you have to think about what their intended outcome of their training is. All right. Everything exists on a spectrum of specificity and carry over to goal activities. And by and large, things like unilateral approaches or anti-based core training, or those hamstring training examples that I spoke about, are going to have just greater levels of carryover for the people that we work with. And so understanding why you are selecting certain exercises and not just going with whatever the traditional approach is, or understanding why these exercises are going to have greater carryover for your clientele, is what's going to make you a better coach. It doesn't mean you can't do the other things as well, but I think you need to prioritize the things that are going to have the greatest level of carryover, because our time to dedicate to training is typically very low, right? So remember, it depends, and go back to the client that you're working with, understand what their goal is and what they want to work towards, and ultimately you can have better selections. Go back through programming questions. Again, ask yourself, whenever you build a program and you go through and look at your exercise selection, audit yourself and ask yourself, am I loading the appropriate tissues? Am I loading the appropriate joint positions? Am I addressing the specific planes and actions? And can I load at the volume and intensity speed that I want? And if you can do that and you can check those boxes, then I think you're probably doing pretty well. And what I find is when I follow those questions, they take me to the approaches that I spoke about just previously.